yara nyilla domoro kadiyata
boy janno sikes restaurant
e sa nakko be ninna dimbal nimba domoro kala janno
domoro seneyata adiyata topotoro fanan kendema bije luntan during tamala abeka domoro ki janni adi manda wala de te ka we bijele anim fanan ka fadi jang ikono e fa e ka fa minne ko pastry anim bakery iko fanan be kalele badde lomba conference lomba workshop lomba ye fo fendin lon dunia kono domoro betama nyillom international o toda number 1
amanke ba domola jandama
e sa domo jang is atariya
wo mu kubandi
sa nakko sa futandin
e oto sa nakko be mu CKS restaurant
dafa nan janna mu yat ni manje dorom bija
aban
CK's Restaurant, known for best quality food and customer satisfaction.
diwli lanni maaro lanni
fop lanni
awa joni mi anda honno gerdeten e ngal ɗo sabu e ngal ɗo Ibrahima jonnal taw joni mi anda se yahay kapitiki ñawloyoɗen ha humpodire e makko est ce que on noon e warude
waɗen no awa
ane kore Ibrahima ma ko to woni
mo Amérique
ko Amérique a woni kede humpitaki fiɓe musidɓe men baluwo
baluwo
ɓe andanta kala ko wawɗa wonde e aduna o si a rewi e juuɗe maɓɓe a jonnay ɗo dépassement o Gambia hara no weeɓi a yahata kadi taw ko mbuɗi ɗin no ƴawi walla no jippi ɓe haalantama ko kala ko falɗa ko rewi sengo ñamete ili nebba maaro basalle pomme de terre kala ko rewi ɗon a hendoto hara no weeɓi kadi wona ɗum ɗon tu ɓe jonnira e mobile phone siko ɗum kadi laptop kala ko wayrode ɗiɓe hay kaspawa ɓe wawma jonnude
National Situation Report on the Gambia's COVID-19 response, to be read by the Director of Health Promotion and Education, Mr. Maureen Ujai, who is also Chair of the Risk Communication and Community Engagement Subcommittee of the National Health Emergency Committee. He will read the statement on behalf of the Honorable Health Minister, Dr. Ahmad Lamin Samate, who is the chairperson of the National Health Emergency Committee. Thank you very much. Mr. Njai.
Thank you very much, Prince Abubakar Aminata Sankano. And I also want to welcome our colleagues from the Risk Communication, in the names of Musa, our Ibrahim, and our media colleagues. We want to thank you for coming and taking time out of your busy schedule to come and attend this important briefing. I'm now reading this statement on behalf of the Honorable Minister of Health, Honorable Ahmed Lamin Samate, and giving you the situation on COVID-19 response in the Gambia. As rightly mentioned by Mr. Sankano, this is the 71st National Situation Report since confirmation of the first case of the COVID-19 in the Gambia on the 17th of March, when the country reported the first COVID-19 case. Currently, there are 2 new laboratory confirmed cases of COVID-19 registered, bringing to the total of COVID-19 cases confirmed in the country to 28. One of these cases is the first confirmed one from the North Bank West region. Both were in quarantine, having a recent travel history to locations with ongoing community transmission. Their respective neighbors reported them to the COVID-19 response team to the 1025 hotline. 47 laboratory test results received. Out of that, 10 from the National Public Health Laboratory and 37 from the Medical Research Council, the Gambia. Of these, while 3 tested positive for COVID-19, 2 new and 1 is the result of a test conducted on an existing case. 44 tested negative for COVID-19, while 24 persons were newly taken into quarantine. 1 new person was discharged after testing negative upon completion of the mandatory quarantine period. The newly quarantined were intercepted from different border posts while attempting to enter the country from locations where local transmission is ongoing. The country currently has 125 persons under quarantine and 6 active cases and no probable case. Globally, since 31st December 2019 and as of 7th of June 2020, a total of 7,082,019 cases of COVID-19, which are in accordance with the applied case definition in the affected countries, have been reported. Of these deaths, 405,081 were registered and 3,456,944 recovered from the disease. Senegal recorded 4,328 confirmed cases, while 2,588 recoveries and 49 deaths. Currently, we have 125 people on quarantine. A total of 1,970 tests were conducted, and 28 are positive. 565 people completed quarantine, 789 contacts traced, and 310 people completed follow-ups. On coordination, daily coordination meetings held at both central and regional levels. These are activities that are also ongoing. There was also a 5-day-long GIS training workshop for personnel of the planning section of the IMS, successfully completed on Sunday, 7th of June 2020. On surveillance, again, I repeat, 2 new laboratory confirmed cases of COVID-19 registered, 47 laboratory test results received, 10 from National Public Health Laboratory and 37 from Medical Research Council, the Gambia. Of these, 3 tested positive for COVID-19, 2 new, and 1 is the result of a test conducted on the existing case, and also 44 tested negative for COVID-19. On logistics and security, the following activities were also conducted. A consignment of 3,000 bottles of donated hand sanitizers received. A visit to gauge the stock levels of commodities at all 7 health regions was also successfully conducted. Banjul International Airport received Smart Links flight, which is Swedish carrier, with 10 crew members on board to evacuate 126 Swedish nationals. A major security exercise sensitizing locals on the importance of practicing regular hand washing and social distancing to curb the spread of the virus. Nationwide Security Task Force tour continues as the team had meeting with National Security Task Force on COVID-19 at the police headquarters in Banjul. On case management component, the following activities have been implemented. Currently, there are 6 active cases of COVID-19 in the country. Ministry of Health, WHO, and International Organization for Migration trained a total of 56 healthcare providers on COVID-19 case management from 1st to 7th of June. Successive cohorts will be trained until 16th June, reaching to 112 healthcare providers from all regions. On this communication, the 2 TV and 5 radio programs successfully conducted. Summary of social media activities include 2 Facebook and 1 Twitter posts shared with a cumulative engagement of 14,421 people. Megaphone sensitization campaign reached 11 communities with key COVID-19 related messages. Summary of calls made to 1025, that's 1025. A total of 134 calls received, 116 COVID-19 we are 116 of them were COVID-19 related and 18 non-COVID-19 related. 4 booked for further follow-up by contact tracing teams and 7 booked for further follow-up by quarantine team. Regarding our next steps, the Minister of Health will embark on, and its partners will embark on the following. Targeted testing plan for high-risk areas is also planned. We also want to expedite disbursement of funds. We also want to ensure that the disbursement of funds is also expedited toward logistics, risk communication and community engagement and safety cluster. There should be more security presence at all points of entry around the country to ensure no people are smuggled in. There is a need to expedite the process of getting a suitable quarantine facility in CRR, and also the need to expedite the process of getting all relevant response staff trained on e-surveillance. There is a need to strengthen surveillance at all points of entry, including the undesignated ones, and there is need to engage all relevant ministries and institutions in the bid to come up with modalities and guidelines in allowing truck drivers into the country. There is also need to encourage the use of locally made face masks or any other masks that you have, but at least there is a need for the public to start wearing face masks. In conclusion, we would like to remind the general public that while some COVID-19 restrictions have been relaxed by the government of the Gambia, there is no room for complacency. As indicated in the Gambia government spokesperson press release dated 4th of June 2020, only markets, houses of worship, and grade 9 students are allowed to resume their activities with modified COVID-19 safety precautions. Details of these precautions are available to the public on the said press release. However, all other restrictions affecting border closure, the airport, restaurants, casinos, bars, nightclubs, and social gatherings remain the same. Considering the grade 9 students, the Minister of Basic and Secondary Education will inform all stakeholders on the modalities of resumption and exams preparations accordingly at a suitable date. Finally, we encourage the public to continue cooperating with the authorities on matters related to COVID-19 and its associated preventive and precautionary measures, as well as the use of locally or readily available face masks. COVID-19 is real. It calls for no discrimination or stigma against COVID-19 affected individuals and families. For more information on COVID-19, you can call 1025 for more details. I thank you for kind attention.
Thank you very much, Director Modunja, for that elaborate update. As you are aware, officially our national record stands at 28 cases. We have 2 new cases and 6 active. On that note, I would like to open the floor for follow-up questions from the media. No questions. Countdown. 5.
We've seen to it that last week the government is some restriction. Many believe that the Ministry of Health is really not in full consultation with the government in terms of what should be done on it, as many link it as political motivation, like the action of the government was politically motivated. Was the ministry fully consulted on some of the restrictions which were eased by the government? And what was your advice to the government fully put into consideration?
Thank you very much. That's a very, very important question. But I don't know where you get your source from. But the government really consulted the Minister of Health. And let me tell you the structures. The Minister of Health, Honorable Ahmed Lamin Samate, sits at the ministerial committee, and he reports. And any document that has to be discussed will be prepared by the ministry and presented to the committee for approval. And that was done. The guidelines, if you look at the restrictions, the restrictions of the state of public emergency regulation. If you look at it, some of you are looking at only the top part of the restriction, the statement. If you look at the bottom, there are also what should be done in public gatherings, in markets, in schools, and churches and mosques. The information is all there, but most of you are not looking at that. But all those guidelines emanated from the Minister of Health. Minister of Health advised the government that if people are to open mosques, they are to open churches, they are also to open markets. These are the guidelines or the rules they should follow, and this were also reviewed at that level. There were discussions on that and agreed on that, and the government came up with a statement. The government cannot just come up with a statement without consulting the Minister of Health. The Minister of Health is a technical arm when it comes to COVID-19 prevention, because it's a technical arm to advise technically to the government about the precautions and also the guidelines on that. So that was done. And I think on our stand, what we're now doing is we want to work with the media to raise awareness and to tell people, despite the fact that the restrictions are about to be lifted or about to be relaxed a bit, there's a need for us to strengthen our efforts and to strengthen our interventions. There's a need for us to strengthen our interventions. So that is already something that we are doing as a government. We are doing that very well.
Just to elaborate, what the director is saying, there are structures in place. We have the National Health Emergency Committee, which is a multi-sectoral. That's where all of us are. They are health professionals, communication experts. We work on the scientific technical data, and there's the special cabinet committee, which also comes with the decision. Regarding the government relaxation, it not happen without our input. We work here very late, trying to come up with guidelines for churches, mosques, and schools. We forwarded it to the minister, and they discuss it at cabinet level, and then they filter it through the government spokesperson. So there is a structure hierarchy and standard operating procedure. So we are not aware of any political motivation because government relies on technicians. We are technocrats, in making, calculated decisions, because each decision you make affects thousands of lives. You cannot rush, and you cannot act on speculation. So this internal arrangement is there, and I would like you guys to please take note of it.
And for the schools also, I want to emphasize, still now the ministry can still give technical advice and guidelines, but the Minister of Basic and Secondary Education, we also have to look at certain indications. If we give them the advice, they still also need to go back. And that's why they are also working very closely with the Minister of Health. These two ministers, since Friday last week, they've been working together, looking at what should be done before schools are open. And then when we talk about fumigation of schools, we talk about ensuring that hand washing facilities are available in schools. We make sure that the classroom sites are also looked at. For example, if there's going to be overcrowding in class, all those also need to be limited. We also make sure that how do we do screening in schools. Lot of information is also being provided. So the Ministry of Basic and Secondary Education is also looking at that. And there's also going to be capacity building. Before, we need to build the capacities of the teachers to orientate them about COVID, and then can they prevent themselves and the students they are teaching. So there are a lot of issues involved in this. So that's why we are saying when the Ministry of Basic and Secondary Education is comfortably, they can comfortably say that, for example, okay, we can now open schools on day X because what health has advised us, we are able to meet it as a ministry. So based on those guidelines, we are going to open schools on day X. That's why we are saying they will come back to the public at a later date, as agreed in collaboration with the Minister of Health. Yeah.
Many said that by looking at what is happening in other countries, not only the government or the Ministry of Health only coming up with recommendation for the public to comply, but in return they were able to assist the general public. For instance, in the area of mosque being open, you see in certain countries, even in Senegal, government assisting those sectors to really abide by the rules that is being set. But in the case of the Gambia, it is only the mayor paper or the mayor press release that have been published. In terms of the enforcement of that particular almost 90% of the mosques that have resumed as of Friday didn't observe the issue of social distancing. And we see to it that in other countries, even the government have chipped in the area of face masks, thermometers, to some of these mosques in order for them to really comply. What you are trying to tell us that you only recommend, part of your recommendation, were some of these things not really put in place for government also to do their part?
Okay. Let me just make that thing very clear. The national coordinator, response coordinator, Mr. Sengon, have already shared a document, and that document is looking at both schools, communities, and as well as places of worship. All that document is now looking at fumigation in those places, in the mosque. I know if maybe you are not aware, but the whole of it over the weekend, like Saturday, our team were so much occupied in fumigation. And if you say government is not participating, I wonder. Because government is the one buying the chemicals, buying the can sprayers or the knapsacks. And I'm coming.
Because you are telling us Saturday.
No, I'm just
and
giving.
Open on Friday.
No, I'm just giving you. Can you take more time? I say these are based on requests. If you want your mosque to be fumigated, you make a request. Most of the requests came Friday, some also came on Saturday, and then some also came on Sunday. And as they request, the team also go and fumigate. That's one aspect of it. And whilst they are fumigating, they also alongside they also do educating them for them to observe social distancing in those places. So that is really something that has been ongoing. The government is really participating. The people who are doing the work are government staff. Government is paying them government is paying them salaries. So automatically government is contributing and government is participating. I want to make that thing very, very clear on records. And all those, even the coordinator has been hired by the government. And all the staff that the coordinator is working with also, most of them, 90% of them are our government staff. So government is also contributing. And I think also said, there's also something that the Ministry of Education is also working on a plan. And all the plan, most of the expenditures are going to be done by government. So I think government is also doing a lot of work in this response intervention. So
Prior before the mosque opened, did the government or the ministry embark on any such by...
Before the declaration, that was already ongoing. Fumigation of public places, it was already ongoing.
Be more specific.
Can I come in? Yeah.
No, places, for instance, if it is mosque, you can say in Greater Bangalore area we covered so.
When government announced that as of today certain restrictions, the date that the government gives is for orientation. People have to prepare. It doesn't mean that when the government said as of today, these activities allowed, you have to prepare. Like in churches, they issue a press release that the immediate Sunday after the announcement, they cannot start. They have to prepare. And if you look at the press release, when we prepare the recommendations, we open channel of communication that each mosque or church or school should have a committee and a liaison person. Somebody will liaise with the authorities so that we can assess that. We don't have a register of mosques in this country where we can say mosque A and Y. They're all informal settings. It's just like with the rice distribution. In Gambia, it's not like German where every citizen is registered as a database. We have to go around and extract raw data. So we have all these logistical challenges to consider. And we cannot just copy something because Senegal is doing it or Mali is doing it. We have to look at our Gambian context. And we are doing it, as he said, the fumigation is the government.
It's another step, yeah.
You have to write because you don't know where your mosque is.
Yeah, tell me.
You have to, according to the press release, come to us, our mosque is in
place X, yeah.
There is fumigation here, director of pharmaceuticals, because we have to account for everything of the national stock. No. Okay, we've gone to Lamin's mosque, we use 10 liters of fumigation chemicals. Okay, all this things have to go. While we are in a state of emergency, but there are also standard operating procedures. So and this is what we are. So if government said that as of today, this activity is allowed, you as a stakeholder, you have to prepare. It doesn't mean that immediately you can start. The date is just as guidance for orientation. From this day on, successively, you can reactivate your activity. So the channel of communication is open with the government. We don't have a ready-made database of all mosques to be able to know what do they need. But the guideline is there and the lines are open. So I think you should understand that.
So do you think that should be done earlier before the restriction?
No, even before the restriction, that was ongoing.
Be specific. Mr. Jan, you can't tell us
Lamin, let me tell you.
Be specific.
Let me tell you. Okay, let me tell you.
We have covered this. We have gone to the.
Okay, now let me tell you.
Because as of Friday, as of Thursday,
okay,
we can confirm to you that the only mosque that we at iAfrica was able to confirm have been was done by the Gambia Red Cross Society, and that was the King Fahad Mosque, the central mosque.
Can I make it very clear? The Gambia Red Cross Society.
Apart from that, we don't know any intervention of the government
make things very clear?
in any area. We want you to be more specific, so as we can tell the people that you don't know, but they said they have done this,
okay,
or
now,
they have done ABC at so place. But if you want to just generalize,
no, we will provide you the list of mosques and churches that have been fumigated as one. Let me tell you, the Gambia Red Cross Society are working very closely with the Minister of Health.
We know that.
So most of the people doing fumigation are volunteers. And the volunteers have been hired by a committee, and committee responsible is a combination. It's a multi-sectoral committee. And this committee, tax is given to both Minister of Health and the Gambia Red Cross Society to lead the fumigation exercise. That is already ongoing. So whatever you see Red Cross doing, they're not doing it on their own, and Minister of Health also is not doing it on their own, but they are doing it in collaboration. And they're doing it in partnership. So that's already ongoing. So what we are now telling you, we give you details of that. We will get the statistics of all the mosques that have been fumigated, and then it will provide, even if you want to, today, I'll call the person responsible, we give you that information. But let's also recognize that government is also doing a lot of work when it comes to COVID response. We're not even talking about food disease, but even the interventions that we are doing, like fumigation, we know is expensive. We also know the capacity building, because the capacity building is also ongoing. And then let me tell you, every day, you know, on every day, there are a lot of requests that are coming for fumigation. A lot of requests. And we always make sure that we act on the requests. If we go to all these hotels, before the quarantine period starts, they fumigate the place. After quarantine, they fumigate. Even those people who are also, positive case, the COVID-19 positive case, where they come from, and their houses, it's all fumigated. When they take them to treatment center or quarantine, they fumigate. And before they come back, they fumigate. So that is all. We will give you all the statistics. So, and government is spending all those, is buying all those chemicals and also providing the services. So I think we should also recognize that government is also doing something.
Yeah, thank you, Director. And the Red Cross is an auxiliary organization of the Gambia government. It receives subvention from the government.
Through the Minister of Health. Yeah.
That's the fact. You are denying it.
Don't say Red Cross never, Red Cross don't
okay,
anyway, no problem.
It's a case that is currently ongoing.
Listen to Lamin, you ask questions, you want facts, you are answering and you are still going to the bush. We are privy to a lot of information we are not privy to because we are in the system. And we are trying to answer your question and you are still behaving as if you know more than us. If you know, please take
You can also blackmail us.
No, we are not blackmailing, we are doing our best to be open to you.
I'm telling you that for the past 20 years, Red Cross didn't receive a budget from the Gambia.
Okay, no problem. Okay, no problem.
Confirm to me that so time they have.
The thing is, because you are
confirm to me. You have to be specific. Confirm to me.
Listen, I have the details, but you are pushing me in a way that because I was there when anyway, no problem. So the Red Cross has been fumigating even before because they are in BCC. They have the list of entities they fumigated. Exactly. Anybody who wants information, you can contact before even the relaxation of some restrictions. Red Cross has been fumigating and they already have experience, and that experience is helping. It can be replicated, and they work closely as an auxiliary organization of the Gambia government. Okay. So whatever is being shown. Next question before we wrap up for the day.
It cannot be wrapped up.
Yeah, ask ask. How other things to do?
For the past 1 week, this press conference was never held, and we have a lot of questions for you people.
Yeah, we are open to answer. You can give chance to your colleagues to answer, and then we are here. We are an open government, and we are. Go ahead,
I want to ask a question.
Go ahead.
I came across a video, and somebody actually called on the program saying that because there was no social distancing observed during this peace celebration and preparation, there was no social distancing, especially in the markets, like absolutely zero.
Yes.
So they are claiming that there is no corona in this country. If there should be corona in this country, then it should be proven because we should normally supposed to have more cases after 2 weeks.
Well,
so what do you have to say?
the thing is that, people are entitled to their freedom of expression. If you are not tested, are they expert to know? If you are not tested, will you know whether you have corrected?
Yeah, they cannot know.
Yeah, okay, so.
But looking at the social distancing aspect of it, one can logically tell you that it's very.
You cannot be logically until unless you are tested, and then you can prove. We follow only the scientific procedure. People can say, okay, because we know that many people are asymptomatic. They can have it in their body, they will not be aware until unless they are tested. And we wait until they are tested. Our National Public Health Laboratory has started testing since on the 1st of June. So which means that we have 2 testing facilities in this country. Tests are ongoing, and then we will continue to go. If we get 1025, we got a call for a suspected case, like the last 2 cases, they were detected because people called 1025. So if you want to know whether you are positive or not, call 1025. You can even come for voluntary testing, and then you have your results. So until unless we test, we will not be able to say something, but we respect the right of people to enjoy their freedom of expression. They have the right to imagine whatever they want, because it is part of the new democratic compensations, this dispensation. But we will only follow scientific results. You are not tested, we cannot say anything. You are free to think whatever you think. That's the answer that we have.
But with what we foresee, especially in macros, what are we expecting?
Well, we cannot speculate. We are testing. Tests are ongoing. Call 1025 if you suspect, and the government is working on it. We are building the capacity, and we'll be testing. Testing will be ongoing, and then that's the thing. So until now, unless we test, we cannot say anything. But like I said, people are free to enjoy their freedom of expression. So that's it. Any? Thank you very much.
This brought me to something that has to do with exactly the police, that the security apparatus that you are mentioning. You just mentioned that they are also trying to make people to observe the social distancing. I've been several times spotted, packed like sardines in their various cars, going to address something that they are not even doing.
Yeah.
So
that question was answered before. It's about this. Okay, the thing is that that's a logistical issue, and it has been addressed. The message has been reached to the police, and they'll work on. So what we are saying is, you have to understand that this government believes in force as last resort. We don't want the contact between the security and the citizen to always result in violence. The police role has to be facilitatory, educate, sensitize, because we understand that social distancing is a cultural disruption. In Gambia, from our birth to our funeral, we are always together. And if you come all of a sudden and tell people to stay apart, it is a really shock. It's a cultural shock to all of us. And that is why we are taking it easy with the people, trying to educate them. If not, the wherewithal is there. The state of public emergency gives authority to send the calaveries and start breaking bones for anyone who refuses to follow the procedures. But we are not doing that, allowing them to treat people with baby gloves. But that's why many people are relaxed. They think that the government is not implemented. The government understands the cultural impact of social distancing, and that's why we are taking it. But gradually it is going. I mean, the message is going down. Like when there was an instruction for the closure of worship centers, it was a cultural shock. Many people did not understand, but gradually they complied. And when the mosques are being opened, religious entities are gradually also complied. So this is an ongoing process. COVID-19 is new. All of us, it caught all of us by surprise. We are all responding globally, from the rich countries to the less blessed countries. We are all just adjusting. That's why we call it response. And it is a novel disease. It is new. So we are all in a learning process. No one is perfect. We all make mistakes along the line, but each step is a learning curve. And I think we should understand that one and appreciate the little efforts that we are making, because we are all not prepared for this.
Let me just, thank you. I think it's also important that we recognize the fact that the government of the Gambia is also one of the first countries in the sub-region to start the preparedness for COVID. When we heard about it, none of the countries were ahead of us when it comes to preparedness. We were prepared, we got our plan, and then we were among the first countries to submit our plan to WHO. So I think it just shows the seriousness in the government at the level of the Minister of Health. Because when we got the first case in China, then the minister convened a meeting with among it, to say the technical people need to come together. We think of what next to be done. Now, after the first thing we did was we sent a press release. Then after the press release, then we had to just inform the people, to be aware of what is happening, and for them to prevent themselves. And then from there we did the plan, and the minister was ahead of us, and we had to follow him. And the thing is, we also have to recognize that. And we didn't wait until we had cases, but we were already prepared before we even registered cases. So I think it's also important that the media pick it up, as my colleague Musa Radley mentioned. And let's also talk about the positive gains of the government. I say also important. What you're talking about, there are challenges here and there, and every strategy, every intervention, there must be challenges here and there. So what we need to do is to work together to address more of those challenges. How do we address the challenges? We cannot address most of the challenges without the media. Now we're talking about awareness creation. We cannot do that effectively and efficiently, for that matter, without the involvement and active participation of the media. So that's why it's important that we work together. We should be seeing each other as complementing each other's effort. I mean, the media should complement our effort. We also complement the effort of the media. At this stage, that's where we are. About those challenges we have been having before COVID, we should have just put those ones aside for now, and we move on. And how do we move on? Is to this type of press briefing, we organize them, we discuss, and we come up with recommendations. And the recommendation here I want to make is that the media still continue to work as they have been doing before, doing the preparation and at the start of this response. Let's just work together so that we start to continue to raise awareness among the general public. Because without your participation, we cannot be able to address rumors and fake news. Because everywhere there are fake news and rumors, it is the media that we're going to use that's going to be the channel to address the rumors and the fake news. So for that being the case, I want to appeal to all of us to work together and to see that we are partners in development. We can't move without each other. So that's the appeal I want to make. And then let's also, whatever we do at the side of government, let's also talk about the positives. It's also very, very key. So this is what I want to appeal to all our colleagues. And I think we will be updating you. And then some time ago, the Honorable Minister of Health, Honorable Damasamatte, also mentioned that the Minister of Health will be doing its own testing for COVID. It took some time, and many people thought it's not going to be possible. But we just, since on the 1st of June, we have been testing in Kotu Central Medical at the National Public Health Laboratories. So this is a start, and we are still doing it in collaboration with the MRC, Gambia office. And then we have the staff, they also have the staff. So we are complementing each other's effort. So we are doing also that testing. So we also want the media also to be informed about that. That testing is already started. We wanted to do the official launching. But even before the official launching, something is happening. So the official launching is going to be when? I think it's going to be like Wednesday. So we want all of you to come and attend that important meeting. That's the appeal I want to make for now.
Thank you very much, Director. And the last two cases, were confirmed through our laboratory, which means Gambia has the capacity. The human resources there, our scientists are there. They can definitely do the testing. So we are grateful for that. And like I said, our doors are open. It's an open government. If you need any information, you know how to reach us. Our lines are open 24 hours. We will give you factual information. We will not rush because information has to go through proper channel, and we are aware of the impact of information on the life of people. So we are partners in this, as Director Hadley said. information is one of the effective weapons against COVID-19 and other pandemics. So bear with us. There are challenges here and there. Like I say, it's a new experience for all of us. We are learning. We grow together. We get fit for future pandemics, which is part of human civilization. Every now and then we have outbreaks, and we learn to live with it and respond, and as well as mitigate the effects. So let me maybe talk until my saliva dry now. You have one more question for us?
Not one more.
How many 100?
Okay. We've seen to it that within the shortage of airports, many countries have eased restriction, and that has escalated the number of cases they've registered. Are we foreseeing such in the Gambia?
Okay.
Follow up to that, the ministry, before advising the government, did they put some of those things into consideration?
Okay. I mean, the assumption is people will practice social distancing.
The assumption.
That's assumption. And also the assumption is, you and other people will be putting on face masks when you go out in the public. That is what we have not been seen doing. So, and then, now I'm coming. And also the assumption is that everybody will be washing hands with soap at a regular time. That's the assumption. And I think if these assumptions are all being implemented and seen as realities, with regular hand washing with soap and water, and then we make sure that we control the borders. We also ensure that people practice social distancing or physical distancing. We also make sure that people put on masks at all times. I mean, we will not be able to register a case. But people are resisting. People are resisting. Certain people, you tell them to put on mask, they say, oh, no, I cannot put on mask. Wash your hands. Oh, I've been washing my hands several times. Can you practice safety? I'm in a haste, I want to go. Go to the bank. You tell certain people to practice. They'll say, oh, no, I'm busy. But they have to. They have to. However busy you are, you have to. So if those things have been implemented correctly and efficiently for that matter, in my view, we can be able to address. But now, if those things are relaxed, the rules are relaxed, and the behaviors continue to be negative, what do we expect? You expect an increase of such of cases. It might happen.
Did the ministry put that under consideration?
Yeah, that's why we are now we're thinking of now planning to have, mass testing. That's a plan. We also now, that's why we also operationalize the laboratory. And if all goes well, the plan is to have testing done at regional level, so that we scale up our intervention. Along the way that we are responding to COVID, we're also alongside trying to strengthen our health systems. We are now trying to build our capacities, trying to get equipment and so on, and expanding our facilities. That's what the minister is also doing with his team. So these are things that, meaning that we are thinking of, that we may have some cases. So if we have more cases, we have to make sure that we are prepared. We're also now thinking of now having quarantine facilities in all the regions. And that's almost happening. You have CRR, that's where a bit of challenge is, but now almost North Bank is there. You have the Upper River region. These are things that we didn't think of, but those things are now up and running. So meaning that we are also prepared. So I think it's important for certain people to recognize the effort we are also doing in terms of preparedness ahead of time. So we are now in response, and we are now responding to the challenges. But key among them is changing people's behavior. We know when at the time of the peak of the COVID, people were almost so afraid worried about the disease. But now, because we are getting a drop of cases, a drop in the number of cases, people are also relaxing their behavior. And that's normal in human behavior. If you understand human behavior, that's the way. Even you give information to people, there are stages of change. If you look at the stages of change theories, you give somebody information, they are also at a certain place called pre-contemplation stage. These are things that before they move from that level to action stage, and for them to be practicing the behavior, it goes through a lot of channels. So we need to understand that. So it is you and us to work together to change people's behavior and their mindset about the disease, knowing that certain people are still denying the fact that COVID exists. And COVID is real. And it is a reality, it's real. People are saying no, but it's real. So I think it's important that those things, if those behaviors are changed, and people practice social distancing, people practice continuous hand washing with soap, the results are going to be positive on our side. Meaning we will cut down the transmission rate, meaning we are not going to have records of cases anymore. But it's difficult. It's just challenging. So, Lamin, you have to help us with your team to start educating the public on. Okay. Okay. I'm just.
What we are saying is that, that to add to the director, we are really investing in our healthcare infrastructure, and we are preparing, to be honest. A lot of investment is taking place. I mean, as you said, the Mban Clinic is there, being prepared as an additional treatment center, and together with the Chamber of Commerce, we are preparing. So we cannot just copy. Like I said, Gambia is a unique country that, when something happens, we study and contextualize it. So like, before face masks become, recommended, we studied it. There were researches, conflicting reports, CDC, Center for Disease Control recommending it, another think tank not recommending it. But we look at the Gambian context and respond as it is. So just because neighboring countries are opening our borders, as a small country, we cannot follow that rule automatically, because we can easily be overwhelmed. Like over the weekend, people calling me asking about the airport. If we open the airport, most of our arrivals will be from countries with hotspots. I know a lot of Gambians are abroad, they want to come home. But if they come, we have to put them under quarantine. And those facilities have to be ready. So you are not coming straightly, you go to your family, you go for 14 days quarantine. And we have to hold those facilities. And hotels are expensive, and they are really chopping into our national resources. So we are preparing. We won't call it worst case. We don't want the worst case scenario to happen. But we are taking measured response and looking at it, projections internally. We look at it. If A doesn't happen, what will happen? People are not practicing mass social distancing. What do we do? Just like with the borders. If we close the borders, people will still sneak in. So which means we have to be prepared. That's why, when somebody sneaks in, it's easily captured and taken to quarantine. Most of our cases are through people who sneak in through the land border. So we are actually preparing for what you talked about, but we follow based on the facts. We don't follow sentiments and then other political, whatever you call it, viewpoints, but just the facts and the reality. Any additional questions?
And the last statement is like the easing of the restrictions is not based on any other means, not political means, but based on technical means. It's a technical advice from the ministry to the government, and the government had to implement. Thank you.
Any question? Because we have other things to do. Any additional questions before we wrap up for the day? We have a lot of work to do.
Can I just add
Yes, okay.
Based on technicalities that you just mentioned, we have grade 9s and we have grade 12s. They all have important exams to do. The grade 12s have to move for the grade 9s for the 11s to go, and then the 9s also to have space. So why just ease up the grade 9s to go and then move on to the grade 12s?
I was in that meeting on Friday. The whole idea is like education is really studying that. Having the grade 9 is just to see what will be, the challenge, for example, in implementing that, or whether there will be any challenge or so. But it's just to start with them. But they also, the exams and all those things, they put all those things into consideration. But they want to start with 9, and then 12 will follow. But even whereas what we put in place, or what the plans for opening grade 9, and there were no challenges, then automatically, I'm sure the following week or so, they might also come up with grade 12. But the grade 9, they don't want to put all the grade 9 and 12 together at once. So they want to start with upper basic, that's a grade 9, and when they are done, they can also think of grade 12. But the exams and all those, they are very concerned. Minister of Basic and Secondary Education is very concerned with that. And then definitely, be rest assured, all the 2 important examinations will be held. And they'll be held in this country. I don't want to tell you the dates and everything, but in our meeting, all the assurances, all the 2 examinations, important examinations will be held. That's the grade 9 and grade 12 examinations. And the rest of grade 12 also will continue. By the time we are done with the grade 9, which is about 505 schools, 505 schools of those are the grade 9. That's going to be fumigated, staff to be capacity to build hand sanitizers, temperature testing, thermometers, all other facilities will be provided. So after that, then we now think of when they are stable, then another level will come. And then we go like that until everything is up. So it's a gradual process. Yeah.
Just to add that, allowing grade 9 to go is freeing up for grade 8, who will be grade 9 left here. If you allow grade 9 to stay again, there's going to be some congestion. So grade 8 that is ready will not be able to have space. So we are freeing up space tactically, making sure these people they already have their transitional exams to go to second university or whatever. Grade 12. That won't happen. It's a national thing. Government can happen that at national level, the grade 9 exams. While grade 12 exam is regional, West African regional. So it has to be coordinated with other West African Examination Council countries to look at it. So that one is a regional context, which it has to be discussed at regional level, which will take some time. So grade 9 is something that the government can easily act on. After that meeting, the technicalities are being done. So we have to look at that. And also, after such sustained restrictions, you cannot open the floodgates at once. You have to do gradual, step by step, to see how public is adjusting to the new reality. And that's what is happening. And then with all these markets, worship centers, because these are all areas where there's a lot of public concentration and coming to schools, and see how the public is responding. Then we gradually roll out to other states as the government spokesperson's press release indicated. Thank you very much, Director, and I believe there's no additional question for the day. 5, 4, 3, 2, 1, 0 is closed. It's done for the day. See you tomorrow. Thank you very much, Director. Thanks, colleagues, the committee, thanks, media, and thanks, Lamin, as usual.
Love like fire. Wow. Love like fire. Xam ngeen rek affaire bi xam ngeen fan la? Skincare la. 2020 lañ wax de. Waaw. Fii nag mooy Kerr fan Kerr zero tache. Perfect skin. Skincare saa su ne rek niñ ko dee defee rek loo lañ soxlaati rek maanaam bu dee am problème ci seen skin yéen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba laka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi defee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw Skincare Plus si yu baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indilee products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon ne dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñun ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon rek classic suitcase ñu dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen lan nag waaw skin ci moom la ñu gën a xamee nag skincare products ci moom la ñu gën a xamee ñu ngi dox tamit bentey tamit si ay dàlla man waaye man nag skincare mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner Kiwi Eye the whole range Lighten Up Gold Tomatine I mean the list can just go on and on and on and on lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox Skincare Plus nag emuñ si Gambia rek ñu ngi United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes, fragrances, men's shirts, accessories. We do dresses as well. We do blouses. I mean, we do shoes. Name it, we do them. Skincare Plus 2020 is our year of perfection. Zero task. Fi mu nekk nii réew mi fii kenn waratu fi task. Kenn waratu fi am problème kanam. Kenn waratu fi am problème picture. Boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii.
Love, love, love like fire. Bring my yoba, yoba good, my fire. Love, 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 love like fire.
Stewart & Co. Solicitors, a legal excellence firm in London that can help you with all aspects of your legal work. If you are looking at immigrating to the United Kingdom, Stewart & Co. can help you to set up business, buy houses in the UK, and will deal with all your legal works from start to finish.
For all your general immigration work, we can help you with that as well. If you apply for any form of visa, whether student visas, settlement visas, marriage visas, or a child wanting to come to the United Kingdom to settle with the family, we can help you to achieve your goals.
Stewart & Co. Solicitors, a legal excellence firm specializing in conveyancing, immigration, litigation, family law, personal injury, licensing, no win, no fee. Contact us today at www.sk-solicitors.com.
No, ini bara.
Ah, okay. Welcome.